Identification of abnormal constituents in the given urine sample. This is the given urine sample. Coming to the physical properties, color is pale yellow, odor is unpleasant, reaction to litmus is basic, it's a non-turbid. And coming to calculation of specific gravity, observed value in urinometer is 1.038, urinometer is calibrated 20 degrees centigrade, room temperature is 26 degrees centigrade. Temperature correction, 26 minus 26 divided by 3 is equal to 2 into 0.001 is 0.002. This is because for every 3 degree rise in temperature, so unit of 001 is added. Here 0.002 is added to the observed value of 1.038, which comes to 1.040, and this is the corrected specific gravity at 26 degrees centigrade. So coming to the chemical test, these are the tests that are performed to identify the abnormal constituents in the given urine sample. Test for protein, sulfosalicylic acid test, no formation of air precipitate, so proteins are absent. Heat and acetic acid test, no coagulant, confirms absence of proteins. Test for blood, benzene glacial acetic acid test, no blue or green color, blood is absent. Test for reducing sugar, Benedict's test, no formation of color precipitate, so reducing sugar is absent. Test for ketone bodies, Rothera's test, no formation of permanganate pink ring, so ketone bodies are absent. Test for bile salts, Hay sulfur powder test. Here sulfur powder sinks to the bottom of the test tube, so bile salts are excreted in this patient. So this image compares and contrasts the presence and absence of bile salts. So bile salts, when it floats, it indicates absence of excretion of bile salts. When the sulfur powder sinks to the bottom of the test tube, it indicates excretion of bile salts by the patient in his or her urine. Coming to test for bile pigments, Faucher's test, no green color, here green color is formed, so bile pigments are excreted by the patient. So coming to the principles of these two tests, principle of Hay sulfur powder test. Bile salts lower the surface tension of the urine and hence the sulfur powder sinks to the bottom of the test tube. Faucher test principle. So the bile pigments, bilirubin and biliverdin in the urine gets absorbed to the precipitate of barium sulfate, which is separated by filtration. So when Faucher's reagent is added to this dry precipitate, so the ferric chloride that is present in the Faucher's reagents oxidizes bilirubin to biliverdin, giving rise to green color. So how to report this sample? The abnormal constituents present in given urine sample are bile salts and bile pigments, and these are mainly excreted in to jaundice. Coming to formation of bile salts. Now these bile salts are derived from cholesterol, which undergoes hydroxylation at position 3, 7, 12 to form triol, and 3, 7 at position 3 and 7 to form diol. Now this further undergoes hydroxylation and oxidation at position 26, the removal of 3 carbon unit to form 24 carbon compounds, that is cholic acid and chenodeoxycholic acid, which are primary bile acids. Now these primary bile acids are activated by coenzyme A to form cholyl-CoA and chenodeoxycholyl-CoA, which are conjugated with glycine and taurine in the ratio of 3:1 to form glycocolate and taurocolate, and or glycokinodeoxycholate or taurokinodeoxycholate. They are further they interact with the sodium and potassium to form sodium and potassium salts of taurocolate and glycocolate, or sodium and potassium salts of glycokinodeoxycholate or taurokinodeoxycholate, which are nothing but bile acids. They are acted upon by intestinal bacteria, where they undergo deconjugation with removal of the 7-alpha OH group to form secondary bile acid, that is chenodeoxycholic acid and lithocholic acid. Now these especially the primary bile acids, which are conjugated with the glycine and taurine, they are excreted in obstructive jaundice because of the obstruction they get regurgitated back to general circulation and are excreted in urine. Coming to formation of bile pigments, they are derived from hemoglobin, which undergoes oxidation to form bilirubin. This bilirubin is carried by albumin to liver, where it undergoes conjugation to form bilirubin mono and diglucuronide. They are excreted through common bile duct and they enter into intestine, where they with the help of bacterial action, it gets converted to urobilinogen, which undergoes enterohepatic circulation. Remaining gets converted to stercobilin, which imparts typical color to the feces. Now the jaundice can be characterized into 3 types: the pre-hepatic jaundice, hepatic jaundice and the post-hepatic jaundice. Now these bile salts are mainly excreted in post-hepatic jaundice or the obstructive jaundice. This is because the bile pigments are conjugated, and this conjugated bilirubin is water soluble, and hence it gets excreted in the urine. So the causes for obstructive jaundice, the most common cause is the gallstones, and the other causes include the cancer of the bile duct, that is cholangiocarcinoma, carcinoma of head of pancreas, pancreatitis, stones in the gallbladder. So these are the causes for obstructive jaundice. So this was all about bile excretion of bile salts and bile pigments in obstructive jaundice, and identification of abnormal constituents of bile salts and bile pigments. Presented by Dr. Preeti, Professor of Biochemistry from JJ Medical College, Davangere.